Okay, we are ready. Happy New Year, everyone. And it is my pleasure to have a seminar today. And I just was thinking about it. We are starting the 25th year of the seminar series. So it's really glad to have this. We have started, I think, January of 2000, actually. So anyhow, it is my pleasure to have a colleague, alumni, and great friend of our department, Dr. Swindle, to come and give us a talk today. Dr. Swindle is an associate professor in pediatric and division of the developmental nutrition in the College of Medicine at UAMS. She received her PhD in educational psychology and research at the University of Memphis. And also, I'm so proud of her that she received her Master of Science in Clinical Nutrition from our department. Great student. And also, she is currently director of the Leveraging Implementation and Management and Knowledge of Impact at the Arkansas Children Research Institute. She holds a lot of positions. I don't know how she does it, but she's a great researcher, great teacher, and great mentor. In terms of research, she has 2 R01, which total of almost $6.2 million right now as a principal investigator. And she just told me that she's another R01 who's been funded, but they are waiting to transfer it. So, and also she received a fellowship, and she's going to be in Australia for a couple of months. So we are so proud of her. And she's also on Obesity COBRA grant, which is almost more than $9 million. COI on the USDA grant, which is another $10 million. By the way, she doesn't collect any of these monies. So she's also on another 3 grants. In the past, she has been a PI or co-PI of more than 20 grants. So very proud, very proud. As I said it, I think the last time she is the only one I know at UAMS so successful. And also we're very proud of her to be in our program too. So she has published more than 77 papers, 65 posters, 35 at the top international and presentation. She's a great teacher, mentor, and for graduate students, some of them, they have received a national award. And thank you for working with our student too. So her research focus on implementation of the evidence-based program for child and family health in a community setting, which is something is new, at least for past probably 5-6 years at UAMS. She's one of those main person to really implement nutrition. And her work to date has focused on the early care and educational setting as a key context of the obesity prevention and nutrition promotion. She's interested in increasing adoption of evidence-based practice and interventions through implementation of the community engagement, dissemination, and implementation science. I can go on and on. I look at her CV, it's more than 60 pages. So I'm going to save her time and welcome Dr. Swindle.
Thank you, Dr. Hackett. I always feel a little bit better about myself after he introduces me. So it's a treat to be with you all and to get to contribute back to the program in this way. I thought this might work, but it doesn't. So let's see about a touch screen. Yeah, that's how it's going to go, touch screen. Or I bet I can do, the mouse works. I just was going to see, okay, we've got 22 folks online. I was going to tell the people online, I'm going to try to monitor the chat to the best of my ability. So if you want to put your questions there as we go, I'll be trying to look at that as well. I was also asked to go back and make sure that you used your, tell me. So the disclosure, here's the, here we are, the disclosure. Is this what you wanted me to show? Okay. And is there anything else I need to pause on for just a minute as we get started? Okay, great. All right. Well, I am just tickled, as I said, to be here with you all. And this story starts when I was a student as well. I was a PhD student that was working on a USDA grant, and we had designed a beautiful intervention and trained teachers to deploy it and all of its best practices. And I would go out into the classrooms to watch it being deployed, and things weren't going as designed, and they were not using evidence-based practice. And I was thinking, with my student mindset on, I'm going to fail. I'm never going to be able to do work in this area. We did such a good job designing this program. We did such a wonderful training. Why can't the evidence make its way to everyday practice? And that's why I got interested in implementation science. I'm going to share with you my journey across some of that work today. And a little bit about what it is that I do. So here's some funding disclosures for you all, and my personal conflict of, or my personal financial disclosure, but also wanted to acknowledge that none of my work is done by myself. And so what you don't see here is a list of many, many colleagues I have to credit as well, and mentors. So thank you all. You know who you are. I'm going to start with a brief introduction to implementation science, because I don't think that's in your course content here. But correct me if I'm wrong. Do you guys have implementation science in any of your courses? Great. I'll give you a crash course today. And then I'm going to walk through 3 different examples in my personal research. So let's get going with an introduction to implementation science. There's a research waste problem that's pretty bad. So more than half of the research that tax dollars and other philanthropic dollars generate never actually makes its way to impact practice at all. And the research that does make its way to practice takes 14 to 17 years to get there. So if you think about it as a pipeline, that's a really leaky pipe. We've got a pipe problem. Somebody call a plumber. We really need to do something about how little of our science is actually making an impact. And so we want to know, not just does the evidence exist, but is it getting adopted? Is it getting delivered by the people that were trained to do it? Are they delivering it to all the people that would benefit from it? And many more questions. So when we think about implementation science, this is the official definition. I'm not going to read it to you, but what I want you to know is in the implementation science, we're making the modifications or the research questions around tweaks to the process. So if you do bench science, you modify things and you study the effects of those modifications. We do the same thing in implementation science. We modify aspects of the process of implementation of an evidence-based practice or product, and then we study the effect of those modifications. So there's a whole list of things that you might want to implement. Could be a policy, could be a program, could be a principle, a best practice, maybe a new pill or some sort of medicine that's hit the environment or the landscape. And all of these things, we would be interested in what does and doesn't impact their uptake in the real world. So these are some key terms we're going to be referencing as we move through the talk today. The innovation is the thing that you want people to do. So all those P words I just rattled off, that's what I'm talking about. That's going to be relevant to as we talk today. The strategies are what you're doing to help people do the thing. And the context is where this is happening. Doing implementation in a hospital in Little Rock is very different than doing implementation in a hospital in Pine Bluff or a more rural community in our state. Or think about clinics or schools or workplace wellness sites or any of the other contexts where you might find yourself doing work in the future. So if you're more of a visual thinker, this is the same idea in a picture. So when we're doing implementation, we have a problem that we want to solve, and we have an innovation or a thing to solve that problem. So in this picture, the problem is I need to get between these 2 cliffs. In your work, the problem might be I need a program to help prevent diabetes. I need a policy that's going to do more with systems and make the system healthier for people to be in. So we all have problems we're trying to solve and things that we want to do to solve those problems. What I want you to take away from this picture is really important to implementation science, that the strategies that we use to get our things to have impact are very different and distinct than the things themselves. So the unicycle is what this person chose as their thing. I might have chosen another thing. I could have chosen a ladder. I could have chosen a helicopter. That would be a favorite for me. Something safer than a unicycle. But this person chose a thing. And the same is true for the problems that you solve. You might choose a DPP program, but you might choose a different program. There's an infinite number of possibilities of things you can choose to deploy in your work in nutrition. But the strategies that you use to get them adopted are distinct. So they've used an umbrella in this scenario. I might have chosen a balance rod, or no, really what I would have chosen is a safety harness with a cable that's connected to something external, right? What our things are matter, and what the strategies we use to deploy them matter just as much. The context also matters a lot in the process of implementation, because we've got a high dangerous situation and the choices that we've made are in light of that. If this was a lower down to the ground or a different context, we may have made different choices about the thing or the strategies that we were going to deploy to solve this problem. So in a nutshell, here's what implementation science is all about. We've got to determine, hey, I've got this new thing that research has generated. Who's using it? Who is it reaching? Who is it not? Why? We really need to understand the gap between the thing and who it could reach and the thing and who it is reaching. The second thing is we want to select those strategies that are going to help us implement our thing. Maybe we choose the umbrella, or maybe we choose something different, like the harness or the balance, whatever. Obviously, those aren't real implementation strategies, but I'm going to give you examples of them in a moment. We select those with the people that do work in that place. If we are doing implementation in a school, we ask school leaders what's going to work to get this program into place. This is a partnered process. The third thing we want to do is determine if our strategies have impact. Are we actually getting more people to use the thing and use it well? But is it having equitable impact? Do those that have been historically marginalized benefit the same from those that have not, in terms of access to this evidence-based thing? So Jeff Curran, who's a mentor of mine and also a faculty member here in the College of Pharmacy, he is an implementation scientist known for making things simple and easy to understand. And this is what he says implementation science is all about. What are you going to do to get people to use your thing? And we ask research questions all around that very simple message. So the thing that I do and help teachers do is called WISE. One of the things, I work on several different projects and innovations, but the one I'm going to talk most about today is called WISE. And it has 8 fruit and vegetable units that are delivered in mostly Head Start settings, but other child cares as well, and K through 2 as well, implemented by the teachers themselves. And there are 4 evidence-based practices. I hope you guys can see those, that are part of the program. One is we have them use a mascot, which is a puppet. She flies between schools and homes, giving children updates about fruits and vegetables and getting them excited about eating fruits and vegetables. The second is we teach teachers to role model intake of those foods. We know that children are more likely to try a food that they see a trusted adult trying. So we train them in that. The third is a hands-on exposure to the food. It is not a Rachel Ray exposure to the food. They get hands-on opportunities to interact with these foods. And the third is all of that must happen in a pleasant, positive environment. So we train them to use appropriate and best practices in feeding. I think this is a really important place to do implementation because so many of our children are here and they're spending enormous amounts of time here. When you do the math, children are eating over 400 times per year with their childcare teachers. And so in some cases, that's more than they're eating with their parents or their other caregivers at home. And it concerns us that there are as many gaps. Remember step 1 of implementation science, we know these are evidence-based practices, but there are huge gaps between what we know is right and best practice to do in childcare and what actually happens. So implementation science is some other things too, which I get to talk about today. I'm going to talk about sustainment, de-implementation, and adaptive designs. These are some things that I find really cool that we get to think about in implementation science. It's not just do the strategies work. We get to think about who they work for and how long do they work and what if I need people to stop something instead of start. So let's dig in. I think you guys know this person. So this is Molly. She is helping to demonstrate one of our WISE recipes with the Vitamix Blender, who is one of our sponsors of this work. And with a child, was this in Louisiana? Yes, with a child in the Early Care and Education Center there on campus. A Head Start. An elementary school. Fantastic. Thank you for providing the photo, Molly. And so this is part of our work on a grant called it's called an R37. That's the mechanism from the NIH. And it's about optimizing our implementation strategies. So in this work, we want to understand who needs what implementation strategies and how do we optimize those strategies. So the questions are about optimization, and the intervention is called WISE. We call the project OptiWise. Isn't that fun? Ooh, right? Y'all are a tough crowd out there, tough crowd. All right. For those of you that maybe want to pursue a research career, which is a very viable career for someone in the nutrition space, there's all kinds of folks that have masters in nutrition that work with us at the Arkansas Children's Nutrition Center. You might be interested in some of the trajectory of how this work got started, so I'm going to provide a little of that background. So I'm a PhD student. I finished that PhD where I thought, oh my goodness, I'm going to fail. I got to figure this out. And so I started to get interested in implementation science, and I wrote a KL2 that was all about, let me understand why it's hard to do good things, good research-based things in childcare. Let me understand the context more. And actually worked with a faculty that was here at the time. This is where I was doing that work. Josh Phelps, who's no longer with us, but he and I did a lot of really good qualitative work around what's it like to try to feed 20 kids in 15 minutes? And the answer is it's hard. And there's a lot of things that make it hard to use best practices. So we got some really great preliminary data through that work. And then I was able to apply to a KO1 to more specifically dig into what's hard or easy about doing the practices of WISE itself. And we went through a partner engaged process of designing implementation strategies with them. And then we're able to pilot test those strategies in 9 sites here in Pulaski County. I know you guys work with UAMS Head Starts. So they've shifted over the years from when we did that work, but it was in those UAMS Head Starts that you're familiar with that we did this initial work. So I work with teachers, so I like to draw things out sometimes with a little help from my colleagues because I'm not artistically challenged. So I wrote this on the back of the napkin and somebody helped me make it pretty. But this is the idea of the implementation strategies that we use to help them do those 4 things I mentioned to you. Does anybody remember the 4 things? Yes. Mascot. Hands-on. Size of feeding practices. Thank you. You guys are rocking it. So that's the thing that we're trying to get them to do. This is the how we're trying to get them to do it. So it starts, everybody got coaching, which is an external facilitation model drawn from the implementation science literature, where we go in and we just help that place. We help those people make change. That's what facilitation is. We do that with some additional tools. So at the context level, the leadership, we sit down with leadership and we go through a formal commitment process with them. Hey, this is what this change is going to be like. This is what you're committing to. This is what we're going to give you. We also walk through an implementation blueprint with them. Here are the elements of the WISE program. Here's what it's going to be like to get started, to be in the middle of your school year, to think about sustaining it over the long term. And then we train a champion, a local champion at every one of the sites to kind of be the cheerleader for WISE and those 4 evidence-based practices. At the level of so all that's place-based. So the facilitation is for place and person. The first level of the house is for place. The second level of the house is for the people that are doing the implementing. And so we gave them a few things in that KO1 study to try to help them implement. They got handouts and videos tailored to where they were succeeding or struggling with their evidence-based practices. They also got incentives, classroom incentives based on their practices. And then they designed and we printed out these beautiful cutting boards that have the 4 evidence-based practices of WISE so that they could remember them while they were doing their food experiences. So did it work? For a 9-site study, a little pilot, it gave us enough idea that it might be working that we could dig in more. So we found we had higher reach at the sites that received those implementation strategies. We found that the readiness at those sites was higher. 3 of the 4 evidence-based practices we were trying to change were significantly improved at our enhanced sites. Which one do you notice is not on the list of improved practices? It's going to matter later. Feeding practices, right. We were not able to have significant impacts on feeding practices. That's going to matter here in a little bit. And then we noticed that very few teachers were left by the second year that we tried to go around and see how things were going. So we noticed we had an enormous turnover problem for sustainability reasons. So to get ready for a larger trial, which in research you're always kind of building to that next and larger trial, we wanted to do an adaptive design, which means that when we look at this picture of this house, not everybody needs everything, maybe. Maybe some places need more, maybe some places need less. Early care and education is a context that does not have a lot of resources. So we really need to only give them what they need to succeed and no more, no less, so that we can optimize our reach and have that equitable impact that we want. So we wondered, does everybody need all of that? And we started to think with our partners, which of these strategies should we start with? How do we know if people are getting enough from those strategies that we start with? How are they responding? And if they're not responding, what more do they need? And so we designed the elements of an adaptive implementation design with those partners. Don't worry about these words, they don't matter, okay? All I want you to know is this is the table that ended up going in the grant. Again, it was co-designed with partners from early care and education. All of our work is community engaged in that way. So they helped us think about, we're going to begin with low intensity, which if you go back to the house is basically the place-based facilitation and the first level of the house. That's how we're going to start. And then they said, if I'm not getting it by October, I'm not going to get it. You know, the school year starts in August, September, October. So if you come in October and I'm not doing this well, I need more help. So we, with their input, decided October is when we're going to decide if they're responding. And if they're not, they step up to add the top layer of the house, the attic, so to speak, and they get the people-focused implementation strategies. So this is that visually. Here's another thing I didn't share with you. We, through that qualitative work, that partnered work that we did with our early care and education partners, they said the incentives are not working. You're making enemies. So you're playing, it feels like you're playing favorites to us. It feels like you don't like me or you like that teacher better. So we totally nixed incentives from our program. And we started to focus more on just the elements that remained. And so again, you've got the foundation was the place-based strategies with just place-based facilitation. And then the more high intensity added those implementer-focused strategies. This is what the design looked like in the grant. This is not super important for you all, but I want you to notice that there's 6 groups that you could end up in at the end of the study. As we move through the school year, maybe you started out strong and you just keep going strong. You're rocking it. You've maintained your response. Maybe you start out strong, but your fidelity to those 4 practices gets a little weaker or a lot weaker as the school year goes on. Maybe you had a hard time at the beginning of the year. This is where about 70, I can tell you the real number, 77% of our sites are non-responding. 77% are non-responding. So then they get randomized to continue with the low intensity implementation. Maybe they just need more time. They just need a little bit more of those strategies to get them going. So they might be late responders. Maybe it just won't work for them at all. They never get there. And then half of those 77 were randomized to step up to get all of the implementation strategies. Some of those respond, and then some still do not. So this is a trial that's looking at, does that strategy work? Does the enhanced or the higher intensity actually lead to better outcomes? So we care about fidelity primarily. How well can they do those nutrition evidence-based practices in their classroom? We also care about how they feel about it. Do they think it's more acceptable, feasible, appropriate? Maybe they're not doing it that much better, but even if their perceptions change, that means they're more likely to sustain it. We also care about child health outcomes. So we're doing some of the same measures that you all do. We go around and measure height and weight on all the children, and we measure resonance Raman spectroscopy via Vegimeter. Have you guys ever got to interact with a Vegimeter before, besides Molly? So it is a finger scan, and the children put their fingers, I should have put a picture in here. They put their finger on a light. It lasts about 30 seconds, and that machine gives us back a reading that reflects generally how many carotenoids they're eating in their diet. Because nobody knows what kids are eating, and nobody is a reliable reporter on what children are eating. The second part of this grant is we get to think about not just did the strategies work, but why? Was it because the teachers were more experienced? Was it because the leadership was more supportive? Because it's a better place to work? Or did it have more to do with our strategies? And we'll be able to answer questions around that. We also get to answer questions about cost, because this could work, the high intensity, the full house, so to speak, could work way better, but could also be way more expensive. So we want to know, for this setting that is limited by cost constraints, is this a cost-effective way for us to move forward? So we have completed enrollment. I'm so excited to say, yeah, it's an 80-site trial. We've enrolled 73, and enough of them were non-responders that we can stop, which is really a great thing, because this is what kept me up at night when we first got this funding. Can we enroll 80 sites? And we did, almost, but enough. We have trained 388 teachers through this work. We have done 396 classroom observations of their use of these evidence-based practices. We have surveyed 709 teachers. We have logged 1,550 different events of facilitation, because we don't just care if the teachers do what they're supposed to do well. We care if our team is delivering the implementation strategies well as well. And we've collected data from 760 children. We've already done 12 site visits, and we'll do 6 more before the end of the trial. So how are things going? Those proposed groupings, the 6 groups I told you that were important from that chart I showed you, that is mostly supported. We have 8% more people doing great out the gate than we thought. Yay for that. And most, or about half of the people, are responding to the treatment condition to which they are assigned. And the response to high intensity is higher so far than response to low intensity. We're getting all the cost information that we wanted. And what I'm really excited about is the sites come back to us and say, okay, we're going to see you next year. And how are we going to keep this work going? And can you offer it to our infants and toddlers? To which we're able to say, yes, soon, which is exciting. So this is only the first 2 cohorts. There are 27 little dots, which you can't probably see that great out there. Probably you'd see it a little bit better on Zoom. But there's 27 more dots to add to this map than were there when at the end of cohort 2. But you can just kind of see a snapshot of where we are, which is a lot of places, a lot of counties, and we're very proud of the reach that we've been able to have with this work. All right, that was example 1. Hang in there for 2 more examples. The second example I'm going to share with you is about fidelity, and not just getting it started, but sustaining it over time. And in the literature and implementation science, there's this idea that you have an exploration phase of the project where you get your partners ready and you start to identify which things are the right things for your problem. And you start to talk with your partners about what strategies might work, what do they need. Then you prepare and you make sure that you've gotten clear on the strategies, you're defining them for the context, tailoring them for the context. Implementation, that's the phase I just talked to you about, where you do all the hard work of getting the thing in place. And then sustainment, which some projects, many projects, never reach, but is the goal. And in the literature and implementation science to date, they've thought about sustainment as kind of a time-marked thing. 2 years after you implement, you should be at a time where it's ready to transition to sustainment. So today I'm going to share some things that make us maybe think about that a little bit more. Is time the right marker of sustainment? So let's think about that together. With an R37, it's a special grant mechanism that allows you to have 2 additional years of funding, and you get to decide what you want that funding to be about somewhere during your trial, which is really fun. And we've decided we want to focus our merit component on sustainment. How are some of these sites continuing and so eager to keep going with us, whereas others are like, who are you again? I mean, truly that happens. Less so than I want to keep going, but it does happen. So we want to understand why that is. About half of our sites after 2 years are ready to transition to sustainment. Can we back our strategies down? Can we use less of the house or different strategies than are in the house to keep them going? Or do we need different strategies altogether? So what I mean by half are ready. So of the 6 groups that you can land in at the end of the trial, why would you start to work on sustainment with those that never responded to begin with? You would be working on sustaining poor practice. And so this is a really conundrum for me, and I hadn't thought through this, and my colleagues in implementation science are saying the same thing. What if you can't ever get people to implement with quality? Do you walk away and say, have a nice day? Do you keep working on implementation? How many years do you pour in resources to try to get them to some standard that they may or may not be capable of reaching? And the reasons why they may not be capable of reaching it may not be their fault. Turnover is so high in some of these places. The resources they're working with can be very limited. So it's a moral and ethical question as well as a research question to me. But for us and for the resources we have available in this project, we're going to start thinking about those that are ready to transition to sustainment, which are those that started strong and finished strong, or they responded to their assigned condition. How do we start to understand what strategies work for them to sustain? So we're very excited to be doing this in partnership with Extension. Does your education lead you to interface with extension agents at all? Okay. Are you familiar with the concept of extension agents? Some yes, some no. This will be really important for your work. So let's just take a second on extension agents. Every county but one in Arkansas currently has an extension agent, and this is common across the country. Most counties and parishes in our country have an extension agent that is funded by the USDA and their local county funds to do work that aligns with the USDA mission. And they have different focus areas. Some of them are family science, some of them are plant science, some of them are animal science, but nutrition is a huge, finance is another one. Nutrition is a huge focus of the cooperative extension agents, and they're the ones that deploy programs that you've heard of, like SNAP-Ed education or SNAP education, FNEP, those kinds of things. And so they are supposed to be people that are already in place in the world, in the real world, to translate research to practice. That was the whole purpose of the extension system as it was established. Over the years, has it worked that way? We could spend a lot of time talking about that. Sometimes yes, sometimes no. But in our case, we're really excited and had wanted for years to partner with Extension as a potential dissemination and sustainment partner. So they came to us, yay, and we were able to say, let's think about what does partnership look like? They're used to being frontline implementers of programs like SNAP-Ed. And so this is a different model for them to think about, but they're working with us to consider not can I implement the program, but can I keep places doing good things over time? Can I be the new facilitator? Can I be the coach to come alongside these childcare programs and keep them going? So we've identified 7 agents in Arkansas already, and we're working to identify some more in Louisiana. And they are trained and wise and have already or will be this month taking on the leadership of helping these sites sustain wise over time. And so we were going to be asking questions about what do the agents think about that? Do they think it's feasible and acceptable? Does it meet all the objectives they have to meet in their jobs? What are their barriers and facilitators to engaging in this process? And we want to really understand that before we scale this model. So we're having them do 4 coaching visits across the year. As our partners had told us before, if you're not up and running by October, it's not going to happen. So they're going to go in August and September of each school year to make sure things are off to a good start. And then they're going to have 2 mid-year school visits where they go into a classroom and coach. And then they're going to have a final school year visit where they start back with sustainment planning, because that planning really never ends. It's an annual thing that has to think about what do we need to keep this going next year and the year after. Something else with this that I'm really excited about. One second. Is the agents are coaching each other. So we had them on a call last week, the new agents with the old agents. And one of our they've been around a year, previously trained agents. And the previously trained agents were sharing with the new agents, hey, this is what this is going to be like. And this is how I did this. And let me encourage you in this way. And so it's kind of a peer learning model for the agents themselves as well, which I think will be great for us to be able to track and follow. All right, my third example is maybe people are doing things that are harmful that we don't want them to do. And we need them to replace them with evidence-based practices, but we can't get those evidence-based practices in place because the harmful things are so prevalent. So I told you to remember the one practice of the WISE practices that we were not able to move in that initial trial. Do you remember which one it was? Feeding. We couldn't make changes on feeding practices. And we do a lot of observations at meals, and all my best ideas come in the field. So just a note on that. If you ever want to be a scientist, your best ideas will come when you're in the place where you want to do the work. Watching a meal one day, and I thought, they can't do what I've trained them to do because they're doing so many harmful things. There's not time to role model. There's not time to do nutrition coaching. There's literally no minutes in this meal where they're not pressuring children to eat more, hurrying them forward, et cetera. So we started to think about not just implementation, but de-implementation. We want them to stop doing things that are not, that are harmful to children. So as we talked about, children are eating a lot here. What I didn't say before is educators are 10 times more likely to tell a child to eat more and to pressure them to eat than they are to help them think about their own hunger and satiety. And so what that sounds like is make a happy plate, take one more bite from me, I need to see you take a bite. We hear that in some cases every 30 seconds at a meal. What we don't hear a lot of is, how's your belly feeling? Have you had enough for your belly? What are you still thirsty today? Those kinds of things we don't hear nearly as much. So there's the things that we want teachers to think about starting. And here's the things that we want them to stop or de-implement. And you can see that they're kind of counterparts to each other. Rather than making negative comments about the food served, they could make a factual comment or a unique comment about the food served. So there are things like pressure to eat, which we've talked about. Social comparisons are things like, hey, I need to see you eat like your friend there. Or your mom would be really sad if you don't eat your broccoli today. Hurrying to finish eating happens where they're pressuring them to go on to the next event in the day without giving them a full allocation of their mealtime. And the discouraged manipulating. At this age, 3 to 5, children need to be interacting with the food, especially if it's the first time they're meeting it. But teachers can do a lot to discourage that. You're making a mess, that's icky, rather than saying things like, hey, what are you exploring there? What are you noticing? Is that hot or cold? And those are examples of nutrition coaching. So here's some of the things we're hoping that they start and some that we're hoping that they stop and start. So again, we worked with our partners to design a de-implementation strategy, and the words are little here, so I'll walk you through the process. We already had really good qualitative data about what makes meal times hard and easy. I told you about that already. So we put those on little flashcards, and we sat down with our partners and said, okay, you got a pile for low importance, medium importance, and high. Sort them out. And so they told us what was really important to them for changing these feeding practices. Then we took that information back and said, okay, here's what you said were high priority things that we needed to focus on. Here's some strategies we've identified, implementation strategies, the how, that would help you make those changes. What do you think about these? And then they told us how important on a scale of 1 to 10 and how feasible every strategy was that we were giving to them. How important, how feasible. And that helped us come up with ultimately a package I'm going to show you in a moment of strategies that they thought were both important and feasible. Once we had that in hand, we walked away and said, okay, we're going to mock up what you've asked for, see if we got it right. And then we took those materials back to them. We even piloted them with them and were able to get their feedback one more time to make sure that it was iterated to reflect everything that they were hoping to see for their setting. So in the end, it looks like this. Every teacher gets another coach, facilitator, and every teacher gets a partner, their co-teacher, to work through this process together with. That's the two things everybody gets. At the beginning of the school year, because the school year is in 2 semesters, right? At the beginning of the school year, they choose which things, if we go back, let's see, they get to choose which things they want to practice of this chart. Which start goal do you want? Which stop goal do you want? They choose. What's cool to me about this work is they also choose which implementation strategies they want. So they get to decide for themselves, do I want an environmental reminder in my classroom? Do I want expert recommendations? Do I want an audit and feedback report? What practical how-to strategies do I need? That happens for a semester, and we provide prompts for them, the teacher and the co-teacher, to talk about it on a monthly basis. They take 3 months to do that. They have the nice holiday break. They come back from the holiday break and we say, okay, you chose goals X and Y. We're suggesting that for the remainder of the school year, you work on A and B. So we've already got their buy-in by them having the opportunity to choose for themselves, but we really know where they're struggling. And most of the time it's pressure to eat. So we get to spend the spring semester working on the goals where we know that they're struggling the most, but they still get to choose the strategies that they want to support them. So we initially piloted this through an RO3, which means a small grant mechanism, and it was interrupted by COVID. So I'm going to give you what I can from that and tell you what we're going to do to build upon it. So we were able to get the baseline data and the midpoint of that school year. And that means that they had the semester where they chose their goals, but not the semester where we chose their goals or suggested their goals. And in just one semester, they had already decreased their inappropriate practices at WISE lessons by 3 and increased their appropriate or evidence-based practices by 5. So that is a spread of 8 that they had improved on like a 20-minute lesson. They had also decreased their inappropriate practices at meals by 5. Also, by midpoint of that school year, their barriers to implementing WISE, the program of WISE, were lower, and they reported that their relationship with their co-teacher had improved. And again, we're really leveraging that through the modules of the program. So we call this program WISE Words, which you would have seen in the next slide. So we, like everybody, got kicked out of the schools when COVID came, and we sat around and scratched our heads for a month or two, and then had to scramble because we still had our staff to pay, but we still had research to move forward as well. So we applied for a CTSA pilot. So that's our Clinical and Translational Science Institute here at UAMS. And they gave us funds to pivot this to an online program. Now, neither I nor anybody on our team are web developers. So if this looks rudimentary to you, well, it is. But that's okay. That's okay. It's an online learning platform, and it serves the function, and it provides a place for the teachers to go online to talk with their coach, for them to access the resources online, and also submit their research assessments and surveys to us online. So we tested that with a series of PDSAs, getting feedback, surveying them, getting more mealtime recordings the best that we could. Sometimes we were meeting folks in a parking lot and exchanging recording files with our masks and our shields and all that on. So during that COVID period, we saw pretty good usage. We had 49 users who logged on 247 times total. So that's 5 logins per teacher on average during COVID. We had really low logins in November and December, which made us short of our monthly goal. Something that we thought was interesting is we agreed, and they agreed, that their goal needed to be to stop pressuring children to eat, which suggested to us that a level of self-awareness, but also that our training was effective at compelling them that that's a worthwhile goal. And I didn't mention to you all, our training is improvisation method-based. I went to improv training, which is kind of wild and something I'd never thought I would do. But we use improv to reduce their resistance, because these are socially conditioned practices, to reduce their resistance to the idea of making some of these changes. We surveyed them at the 2 time points. All I want you to take away from this slide is that they didn't think it got, their ratings of how well they liked it didn't get worse over time. So they liked it to start, and they continued to like it at midpoint. Still in the COVID setting, we were seeing decreases in those inappropriate feeding practices, really large ones, 56%, and driving up the evidence-based feeding practices. Those were based, we couldn't live code, obviously, but we were coding audio recordings. And some qualitative feedback that I want to share with you all is, obviously they had competing priorities. How could they do anything but keep children safe during COVID? It was wild what they were doing. They had erected barriers in their classrooms. They had 3-year-olds wearing masks and shields. They had split classrooms where you take this half all day and I'll take, I mean, the logistics they were managing was unreal. The programs agreed to do this with us at all during this time kind of blows my mind. So that was an enormous barrier. They also talked about how they didn't feel like they were getting enough feedback from their coach. This also makes a lot of sense to me. You don't feel connected to somebody that you just are interacting with online that you've never met. We did find some positive things, though. They felt really connected to the positive communication tools that we were giving, and they remembered the training, even though it was online on a Saturday, which meant a lot to us. They also really valued those parking lot connections. They talked about that time that lady came out and she helped me with this and that. So even the brief in-person stuff that they were getting, they noted. So here were our takeaways from that. The program is memorable. It's having suggested impacts that we want, but relationship building is really hard to do virtually. And I'm a big proponent of, I think that change happens in the context of relationships. If you can't build a relationship virtually, we've got to find another way to do that. So we started to think about a hybrid approach where maybe this online platform still had value for delivering resources, but those in-person connections with a coach were going to matter long-term as well. So we revised our approach and put it back in for an R01. This is the one that is forthcoming, and we'll be able to determine in a fully powered trial the effects of this package of de-implementation strategies on teachers' feeding practices. What's my favorite thing about this is not only do we get to determine the impacts, we get to determine if they stick. So what is not being studied very much in implementation right now is sustainment of de-implementation. And we've talked about both today, but if we can get people to stop doing something that's culturally ingrained and normative, will they continue to not do that? Or will they slip back into habits and routines and things that are more culturally normative? So we get to study that over time. We also get to study, why do things work or not work? As I mentioned, I think that change happens in relationships. So there's a newer theory of change in implementation science called the trust building theory of change. And we have selected constructs from that model that we'll be able to track over time. Will they make changes if they trust their coach more? Will they make changes if they start to trust each other more? What we heard anecdotally is that they're calling each other to the carpet during meals and saying things like, hey, you told me your goal was to not pressure children to eat. And I think what you just did there was pressure. They're not doing that in front of the kids all the time, but we're creating those opportunities for them to do that in their monthly conversations. I wanted to share this slide for any of our folks that are online just to mention that, as Dr. Hackett mentioned, I now lead the link at Arkansas Children's Research Institute, which is all about implementation science and engaging our communities in meaningful ways. It's my goal that every Arkansan would know a scientist and that scientists would start to know their communities better as well. So that's the link that we're trying to form. And we offer a range of services around community engaged D&I science, qualitative services, all of the methods I discussed in my talk today, we offer for fee for service. And so you can make a request using that QR code there. I've left a little time for questions, and I look forward to hearing what you all have to say, share, or ask. I'm just looking online as well.
Thank you very much. Any question?
None in chat, but if you are on chat and would like to add a question, I see one new. Oh, Heidi's just saying that I did a nice job. Thanks, Heidi. Okay, great.
So, school lunch program, there's a lot of ways to it. The kids, they get lunch and they throw it away. Have you ever looked at it, how your program is really improving the kids to eat better, or they know the value of the nutrition, or
right? So Dr. Hackett, for those online, I'll repeat the question. He's asking if our programs reduce waste at the meals. We have not implemented a plate waste protocol in any of our studies. Maybe we should in the future. It's expensive and we haven't been able to do it. What we have been able to do is food recovery. So Head Start policies can sound confusing and vague to some that are doing frontline work in this space. And so we know that Head Start staff are much more likely to experience food insecurity. And that's some of the reason why they pressure children to eat. They're very worried about having food themselves. They know what it's like to be food insecure, so they pressure children to eat more. And so one of our projects, the preliminary work around the RO3, we were able to do food recovery on site and clarify policies about what food that was offered to children and not consumed could be held back and used for feeding staff or distributing to families. And so that we didn't do any evaluation around that. It was more just something natural that grew out of the project, a need that we were able to meet. But I have interest in that area.
Is there any incentive for the teachers that implementing this? At the end of the day, what it is for the teacher?
He's asking, what's the incentive for the teachers? Why would they want to do this? So I have to make that argument very frequently. And we cannot pay them to do the program. What we're able to do is pay them for research assessments. So surveys that they do or things like that are additional requirements on top of their job. The way that it is shared with the teachers is Head Starts as an agency adopt the program or they don't. If a Head Start adopts the program, then the teachers are expected to do that as part of their job obligations, just like they would teach social emotional skills or shapes, letters, colors. It just becomes another topic or subject that they are teaching at school. We get them to want to do this by aligning our lessons with the standards they have to meet. So what's really popular in Head Start is there's a standard set called TS Gold or Teaching Strategies Gold, and they're always having to build these portfolios about TSG, and we help them do that. So we have, for every WISE lesson, we say, these are the TSG objectives you met today. And so they get to check, check, check. Yay, I met my TSG. We are happy because they did the lesson, and hopefully everybody goes home happy. So no direct incentive, but hopefully it is helping them improve their instructional quality and meet those objectives that they're expected to meet.
Looking at my words, you mentioned that you wanted to follow the implementation system. What is that like?
Yeah, so we get to keep going back and back. I think we're going to follow these classrooms for 3 years. And unlike the R37, where we're going to study active support in the sustainment phase, in the de-implementation phase, in the de-implementation study rather, we're going to just watch and see what happens. If we withdraw that initial de-implementation support, what happens?
Classes that are doing the implementation study also still be WISE in the class?
No. WISE Words is a program that we designed to be a run-in to WISE or an independent standing program. Because harmful feeding practices compete so much with the things that are evidence-based about WISE, we saw a need for a program that could precede it or come alongside it, or just, it maybe a program is never ready to do WISE. You know, remember those 3 boxes of places that never could respond? Maybe they'll never be ready to do a program like WISE, but they still feed children 3 times a day, and we can improve their feeding practices at those meals. That's the idea. They don't have to be doing WISE. And we'll be working with more diverse centers because of that, Molly. It won't be just Head Starts. Then we're going to be more diversified in the types of centers we'll be working with as well. Maybe more state-based programs and things like that.
Amazing talk. I feel like every time I listen to you, I learn something new.
I was about to say, Lisa, I think you've heard this talk 20 times. Thank you.
Like so? Can you hear me? Oh, yeah. Okay. I was wondering, have you been able to identify commonalities or factors amongst those non-responders?
So that is what those qualitative site visits are designed to do. We go at the end of the year and we ask questions about, what was your relationship like with your coach? What does the director do here? Those kinds of things. And we haven't done the analysis on that yet, but I can say anecdotally that the cohesiveness of the place where they're working, some of the places that are doing really well, they have these natural planning sessions and they're just building it in. Whereas communication is a barrier at places that seem to struggle to implement. That's just one example, but that's the kinds of things that we're getting out of the qualitative side visits. When we go for those, we do a focus group with the teachers, an interview with the leadership, and then we just hang out all day, which is kind of the best part of just seeing the dynamics of how this center operates. Mm-hmm.
Is the WISE curriculum available for to use for an organization to use it?
Yeah, so the question for those online is the WISE program available for use? And the answer is yes. So I'm a co-inventor on the program, and this might be interesting for students. If you are an academic and you create something, the university owns it and they license it through an entity called BioVentures, and they're like the intellectual property people. So even though I'm a co-inventor, they are the ones that kind of own the rights to the program itself. It has been licensed to an external company called Cafes, Children and Family Services. And so anybody not involved in our research could email Cafes or go to our website and buy the kit. And we've had people do that for homeschooling. We've had people do that for after-school programs. There was a place in West Virginia that did this really cool multi-generational thing where they did the lessons at nursing homes with children and older adults together, which was fantastic. So yes, it is available for use broadly. And we will do future research just on the scaling and dissemination of the project or the product itself. Thank you. But everybody gets it for free in the research study. We build that into our budget. It's pretty low cost, even outside the research context for curriculum.
My last question is that with the Head Start program, all the time since they are federal funded, all the time they are at the chopping blocs.
Mm-hmm.
Remember around 20 years ago, they wanted to chop the whole program.
Mm-hmm.
With changes in the politics and the government, are you
Mm-hmm.
worried about these
Mm-hmm.
affected their budget, therefore?
Right.
they're gonna be access?
Right. So Dr. Hackett is asking, are we worried about potential cuts to the Head Start program and the cascading effects that would have on the kind of research that we do? I am always worried about the children in these programs and the families that they serve. I think that they are under-resourced to start, and every cut they experience is a detriment to our society. We're at your congressman. That's all I can say. It's a very valuable program, and I hope it's here for a long, long time.
Okay, I love the de-implementation part of what you discussed today. And so it's in the childcare setting, but has that been done with parents?
I get this question all the time.
Amp it up.
Okay, amp it up. Here we go.
Because I tried interaction therapy
Yeah.
like a year ago.
PCIT, yeah.
And so it seems like something could exist that is both of those together. And I'm curious, is anyone doing that?
Yeah, no. I haven't thought about the connection with PCIT before. That could be really great. My colleague, Dr. Julie Rutledge, who none of this work could happen without, she's a parenting expert. She's my counterpart in Louisiana. And we have visions to write one of our next grants that would adapt the de-implementation strategy for delivery with parents. And then we could ask some really interesting questions around how did children do if they get it in childcare versus if they get it at home alone versus a combo? And that could be really fascinating. And that model is a good idea. We'll definitely take a look at that. Thank you. Well, I don't see any questions online, and I see that we have a moment remaining. And if I was a student and you kept me a moment late, I'd hate you forever. And I don't want you to hate me forever because I'm going to send you an evaluation. So I'll send it through Courtney and ask you guys just to take 5 minutes to share about your experience today. It helps me demonstrate to my leadership that I wasn't at the mall today. I was here with you. And that helps me for the things I have to achieve in my life too. So thanks for letting me be with you. And I'll hang back in case anybody had questions that they did not get answered. Thank you.